female for chronic Trochanteric Bursitis. MRI does show pretty moderate to severe bursitis. She's a little bit tender, somewhat posterior and proximal to the greater trochanter, so a little atypical, but I think it's all consistent with greater trochanteric bursitis, so we're going to go ahead and do an ultrasound guided injection. So here we're looking at the apex of the greater trochanter. You can see the Gluteus Minimus tendon over the anterior facet of the greater trochanter. Probably has about moderate-ish tendinosis. It looks moderately thickened to me. Also here you can appreciate the lateral facet of the greater trochanter where there's moderate thickening and tendinosis of the Gluteus medius tendon, which attaches to that facet. You can also appreciate the overlying iliotibial band. Here we're going posteriorly. You can see the posterior facet of the greater trochanter as it's a rounded facet. Nothing attaches to the posterior facet. Here we're starting our injection. We're using a 3.5 20 gauge spinal needle, and we're keeping the stylet inside as it makes it easier to cut through the tissue. Here we're just getting just above the Gluteus medius tendon with the needle, and once we get the needle where we want to, we take out the stylet. And here we're inserting our cortisone. We used a cocktail of 3 cc's of normal saline mixed with 5 milligrams of triamcinolone. You can see the greater trochanteric bursa just slightly distended, and here we're beginning the injection. And here you can see we're spreading out the space between the Gluteus medius tendon and the iliotibial band, essentially in the greater trochanteric bursa. You can see some of that injectate flashing through that bursa going posteriorly, and it essentially contours the Gluteus medius tendon, and I call this a contour sign, which really confirms that you're in the right place with your injection.